You're listening to The Social Workers on WCDB Albany.
Good morning. You are listening to WCDB Albany. This is The Social Workers from 9 o'clock to 10 o'clock. The next hour, you'll be listening to The Social Workers Radio Talk Show. I'm here with Alyssa Lotmore, and we are renewing, reinvigorating The Social Workers Radio Talk Show. What we'll be doing for the next hour is having a few guests, both in the studio and by telephone, and we'll be talking about issues related to social work, related to the community, related to public health, and lots of very, very exciting issues. We have a couple special guests. First, on the telephone, we have the School of Social Welfare's own Catherine Zox. Catherine, welcome. Is that working?
Hearing you.
Okay, can you hear us now, Catherine?
I can hear you now.
Great.
It sounds really good.
Great. We're a little rusty, so we're getting started here. So on the phone, as I said, we have Catherine Zox. Catherine Zox actually originated this show several years ago, and we'd like to welcome her back as a very, very special honored guest. And Alyssa would like to say a few words.
Hi, Catherine.
Hi, Alyssa. How are you?
I'm great. I'm so excited that you could come on today.
Thanks for inviting me.
So for those who are listening, as you know, Catherine has been our host for the past several years. She originated this show, but she really wanted to, the mission of the Social Workers Radio Show was to educate and enlighten through radio the University at Albany and to, extend communities about current social work trends. And that's exactly what you've done. So can you just sort of recap? I know it's a short time to, you only have such a short time to recap, but what are some of the great things that have been accomplished this year as we've, brought this show and the course and all of the things to the University School of Social Welfare?
Well, first of all, I want to say, Alyssa, Eric, thanks for having me on the show this morning. I think it's very exciting to be able to be on the first show of the season, which is great. Yes, I mean, we actually had two missions for the show originally 4 years ago, and one was what you described, enlightening the public about social work issues, but also we wanted to engage the students in the role of traditional radio and get them familiar with media and create media-savvy social workers through the medium of radio. And I think we've done that. We've done it through you. You co-hosted the show with me for a year and a half, and then became immersed in radio and actually, which morphed into actually teaching a course at the university, which I think is great. I guess my question is, because we are transitioning, I did the show for 4 years now. You guys are going to do it. How is the show? Is it going to be the same? Because this is the first show, the transitioning. Is it going to be the same? How is the mission changing? And how do you connect this mission or the goal of the radio show to the courses that you're teaching? And I know you're teaching some courses in the spring in media savvy social work. So I was really curious about that connection.
Definitely. Well, from taking a quote from what one of the students said after the summer course, which you were a guest lecturer, they said, I quote them, "Zox is a hard act to follow." So, using that sort of as we're transitioning, you are a really hard act to follow. So I think we're going to be, trying to keep some things the same, but at the same time developing our own. So with the course, Dr. Hardiman's doing an independent study. I'm doing an intercession course on media savvy social work. What we're going to start trying to do is using, now that we have these courses in place where students can learn, having them then sort of transition and have more of an active role on the show, as they're doing their own research. And they've been practicing, being on the radio, hearing themselves, practicing, trying to be able to engage audiences, have them have a more active role on the show and present and show what they're doing at their internships or what's going on in the community, and having that be a bigger role, as well as more faculty come on as well.
Yeah, I think that's really exciting, Alyssa, because I think this whole interactive process makes media-savvy social work real. And I guess as you're describing it, that connection between being able to actually co-host a radio show and then also take a course or several courses in media-savvy social work is really important. I think one of the things that I learned from the course that I was the lecturer or the guest lecturer during your course this summer was that one of the difficulties with social workers in terms of becoming media savvy is their fear that they are not the experts, that they don't have anything to say for whatever the reason is. And for me, I think that's one of the things that I learned over the past 4 years as co-hosting the show with students. So I think that's one of maybe the tasks that you and Eric have in front of you. Really have to get social workers over the fear of feeling that they're not up to the task of engaging in the media, and particularly, my area of expertise is radio. Obviously, there's television, and then there's, I think, Eric, you have done a lot of work in social media. So, it's a whole wide range. But specifically, what I enjoyed this summer in the course, and which was part of the course, was the Blog Talk Radio that I had introduced you to. You and I actually had a show, or still do. Maybe we do we?
Yes, we do. We have to do some more episodes.
Yeah, we might. Yeah, we said sort of intermittent. But anyway, once we started doing Blog Talk Radio, which is an internet radio show which you can use as a teaching tool, I found the students really, really hung on to that and enjoyed the process, and that as a learning tool, which I think is something I think you're going to carry on in the courses with the students. I'm used to doing the interviewing, so ask me another question.
Well, it's even just as you're talking about how with the students, when we went to the NASW conference, national conference this summer, we presented on media savvy social work, and there were a lot of people in the audience who were, in the academic field or have been practicing for years, and they still had these fears and anxieties of being able to go in front of the media or being able to talk about the topic that they've been doing for 15 years. So I think it's that what you've been saying is practice and using tools like Blog Talk Radio to practice what you're saying, get that comfort, and then being able to, make the public your client and get all of that information out there, instead of what you're just doing with your agency, being able to spread it and share that knowledge and resources with the larger audience is really important. So that's what we're really hoping to do with the show this year, is have more people become comfortable to come on and share their knowledge with the community.
Yeah, I agree with you. What did you find? I think one of the things that was interesting to me with the NASW conference this summer in Washington, D.C., was that we had not a huge audience, but the audience that we had, really, they were engaged. They came up to all of us afterwards, to you, to me, to Dean Breyer-Lawson, and I think they were very surprised about the work that we had done. They weren't aware of it. Some of them had also had some experience in traditional media, radio and television, but most of them hadn't, and they were ready and kind of willing and wanting to jump on the bandwagon. So I think helping to connect maybe some of the other schools of social work to what you're doing is also an important piece of all of this, besides just teaching the students to be media savvy social workers, but kind of making this connection amongst social workers and social work schools.
That's definitely true, but each school offers so many great resources and tools and has these connections, but if it's contained to that school, the media, using the media can be a way to share that and spread it. So that's why collaboration is such a great tool.
Yep. So now you're going to do the show once a month?
Yeah, so our show will be on, like we did last year, once a month, first Thursday of the month, but it'll be replayed throughout every Thursday until the following first Thursday when the new show will air.
One of the things I think that was an issue, too, I think the students really grasped onto co-hosting once we were able to get them on the show. And they liked being on the air and overcoming some of their fears. But the issue was production. That was an interesting topic because it's really hard to get social workers involved in the production aspect of doing a radio show. I'm not sure if that's the same in television and other areas of production and other mediums, but that was one of our issues, and I know. Well, there it is, Eric. You're the doing the board, yeah. So that would be interesting because I think that's one of the areas that social workers traditionally that's not their area of expertise, production, IT kinds of things. I don't know if you're going to be covering that during the year.
We will, definitely. One of the things, I think you're absolutely right, Catherine, one of the things that social workers tend to shy away from is technology, and we tend to view that that's not our purview or area of expertise, and I think the radio show does give a really exciting opportunity for students that are, developing social workers professionally. It gives them a chance to try out some new technologies technologies and strategies for communication. So we're excited to make the radio show, that's the social workers, to make that a learning lab for students and to really be a place for community engagement.
Yeah, I think that's a great idea, and I think we had talked about this a little bit. This was before the show, but the students that we had this summer who were engaged and involved in the course and Blog Talk Radio, they were terrific MSW students who, it seemed to me, and you can correct me, Alyssa, if I'm wrong, but they still should stay connected to all of this in whatever way they can during the year.
Yeah, a few of them already have came up and said they wanted to still, present or be on or co-host or do something to still get involved with that, because we've talked about it so much over the summer that now that the show is back on the air live, it's something that they're very interested in. But it all is started because of you. So we just want to thank you for that, for bringing your talents, your skills, your expertise, and pretty much volunteering your time to make this happen so that we can now continue it. So you're sort of handing the torch, and we hope that we can really continue what you've started with the momentum that you've started.
Well, terrific. It sounds like you're already off to a great start, and thanks so much for having me on the show this morning.
We also hope, Catherine, that you'll be back on many times, and maybe that you'll come back in the studio with us as well, and we'd like to consider you as sort of an honorary consultant and regular contributing guest, if that works for you.
It works for me. It sounds great. Next time I'll see you in the studio.
That sounds
Thanks,
really
Catherine.
good.
All right, guys. Have a good show.
Thanks a lot.
Yeah. Bye-bye.
Well, that was, Catherine really has done a lot for the school, for this program. So we just want to hopefully that you'll continue to listen and have a great experience as you've had in the past. We're going to have Dean Catherine Breyer-Lawson come on in a few minutes just to sort of update us on what's going on with the School of Social Welfare this semester.
Dean Breyer-Lawson, welcome.
Well, thank you. I'm honored to be back on this show, and I thank both of you, and even more enthusiastically, our wonderful Catherine Sachs for inspiring the entire media-savvy work in our school and this show.
Great. We are very excited about the show. For those listeners who are just tuning in, you're listening to The Social Workers on WCDB Albany. The next hour, the next portion of an hour until 10 a.m., you'll be hearing us interview Dr. Robert Miller. Right now, for a few minutes, the Dean of the School of Social Welfare, Catherine Breyer-Lawson, is our guest by telephone, and she'd like to tell us about some of the upcoming events at the school, some of the news, some of the zeitgeist about what's happening at the School of Social Welfare.
Thank you. I'm going to flag just two ongoing areas of pride and hard work. First, over the summer, our own Alyssa Lotmore, your co-host, Eric, taught a wonderful course on media-savvy social work with Catherine Sachs, very much the celebrated guest lecturer and guide for many of our students. That work over the summer also involved our going national with a presentation at the NASW National Conference in D.C. And our presentation there, that's Catherine Sachs, Alyssa Lotmore, and I, helped spark a national innovation exchange and dialogue about the need for more development, more skill building in media-savvy social work. So that's all very good, and Alyssa's going to be teaching this course again, hopefully, Eric, with your help and Catherine Sachs' wonderful support. So this media-savvy work in the school is a very featured source of pride and ongoing development and mobilization of new talent like yours, Eric.
Great. Thank you, Catherine. Thanks for the updates. We also hope you'll use this forum. We'll have you call in at the beginning of each Social Workers Talk Show. And if you have news about exciting colloquia that are happening, community events, workshops that are being offered by the School of Social Welfare, this would be a great opportunity to spread the word a little bit about that.
Wonderful. Thank you. And have a great rest of the show.
Thank you so much, Catherine, for calling
Bye-bye.
in. Okay, so you are listening to The Social Workers on WCDB Albany. Right now we have in the studio a very special guest, Dr. Robert Miller from the School of Social Welfare. And I'm going to have Alyssa introduce Dr. Miller here for a moment.
All right. Dr. Miller is from the School of Social Welfare. He just returned from his trip to the White House, where he was at the Summit for HIV among gay and bisexual men, Focus, Action, and Impact. So it was the first such meeting at the White House, and he was able to talk about some of his research. So before we get into the questions about your research, I kind of want to know, what was it like to be invited to the White House? That's really what I want to hear about first.
Well, first of all, thank you for having me. It's a deep honor to be here. It was a profound honor. So in some ways, it's fascinating growing up about 16, 20 blocks from the White House in Washington, D.C. And friends of mine said, well, is this the first time you've been there? Well, no, because as a little boy, my folks took me to the White House. So I've seen the White House before. But in all seriousness, it was a collection of 49 researchers and activists and policy analysts who were invited by the Office of the National AIDS Policy in the office of the White House that is chaired by Douglas Brooks, who is an MSW. And it's the first meeting in the history of the epidemic in the United States focused on this particular population. And so in many ways, you got a chance to see the number of researchers that have grown from when we were first doing this in the early 2000s. There were 14 black gay male researchers who were doing this work. We've come to understand now that we're somewhere near about 39 to 40, which is huge. And part of that is the work of advocacy on the part of the population. I should say, by way of history, this became a national focus specifically for African American gay and bisexual men after a report in the early, I think it was April 2005. There was a report of a random sample, or a national survey of 3,000 people. And in that subpopulation of African American men, the 46% of that population were HIV positive. 67% of that population did not know they were HIV positive. We found that to be an outrage. And so when I say we, they, when a number of activists came together and they approached Judy Gerberdine, who at the time was a director of the Centers for Disease Control and Prevention, and insisted that there be a special consultation meeting. And that meeting happened in August. And since that time, a number of important events, particularly related to focusing the epidemic on a subpopulation that has been persistently overburdened by the disease. And so while there's a lot more to do, there's been some significant advantages and progress over the last 20, 30 years. Well, 33 years now.
Yeah, it sounds to me from some of our earlier conversations like the landscape for work and research and practice intervention with the HIV/AIDS population, folks impacted by that set of illnesses, has really changed over the last 20 to 30 years. And how has that impacted your own work, those changes?
Well, in some ways, we're just fundamentally grateful that people are living. That's the first thing, in a way, because again, when this epidemic first started, people were going to funerals 20 and 30 at a clip during the week. It was just nuts. And the evolution of the pharmacological developments have been extraordinary as well. So now, typically, and this is the point, once you test and you become, and you know that you have HIV, there are pharmacological interventions that can keep you healthy and live a normal, productive life. The challenge is we still don't know long-term effects around organ challenges, but on the main, you are managing 15, 20 years in ways that you had not. And so that's an extraordinary thing. That's the upside. The downside, of course, is that now that people are living longer, people have seemed to wane. The interest has seemed to wane. There's the suggestion that AIDS is over. And the point of fact is not. In fact, it's progressing in some populations in some extraordinary ways.
And that's what I wanted to ask you about, because, when I was growing up through school, that was something that was always discussed. It was always one of the topics that was in the news. And now it seems to have not been in the news so much. And I didn't know if it was because, as you had just said, people are living longer. There's so many treatments that are making the quality of life a little bit better than it was before. And is that why it's sort of taken a shift to not as much attention? Because in the minds of some people, it's the treatment is progressing in a way that's more beneficial, that it doesn't need to be in the forefront of the news.
Well, and that's an extraordinary moment. Again, to the extent that we can, depending upon depending upon the level of viral activity, depending upon when in disease course you have come into care, you can take anywhere from 1 pill a day to as few as 5 pills, which is way different than when it was people were taking 15 and 20 pills a clip. And so in that way, that's an extraordinary advantage and advance in ways that we're all very, very grateful. The downside, again, is that there are fewer public dollars being given to this. Issues around prevention they're funding some, but not nearly as much as they had. At the same time, the federal legislation through the Obama administration with the Affordable Care Act has done an extraordinary thing in many, many ways, and brought people into care. However, there are still challenges around specific funding for the niche issues for some subpopulations, particularly 13 to 24-year-old African American gay and bisexual men, which continue to persistently have the highest rates of incidence and prevalence rates of the disease.
Well, I saw that only, it says in this one article that only 30.5% of those 18 to 24 have treatment or
So part of the way that plays out is this notion of when a person decides to test, if they learned that they are HIV positive, then they're obviously brought into care. Part of being brought into care is doing a holistic understanding of what's going on for them, as well as putting them on meds. At the current stage of the epidemic and the way we're treating, or the medical providers are treating, is once they learn, they'll put you on a regimen immediately. And that is to gauge in viral suppression. To the extent that you have less viral activity, that means the virus is dormant. If you are suppressed, you have a far more difficult time. In fact, it's nearly impossible to transmit the virus. Which then brings to the next point. There's a drug out, Truvada, and it's conceptualized as pre-exposure prophylaxis. So if people are on PrEP, which has an efficacy rate of somewhere around 96%, if you take it daily, that wards off the virus. And so if you're on PrEP as an HIV negative person and a person who's HIV positive, if they're virally suppressed, there's no access for transmission in that way. I didn't say it exactly right, but you get the point.
Yeah.
That's if all things work well. The challenge is, and we've seen this in other issues like tuberculosis, diabetes, medications, people are not always adherent. And to the extent that they're not adherent, that allows for the virus to mutate, for viral activity to increase, which then increases the likelihood of more virus be transmitted from one sexual partner to the next.
Yeah, it strikes me, I have a couple of questions for you, but it strikes me as a very, very complex phenomenon. You have the public health challenges around communication, around stigma and stereotyping around having this illness. You have issues around awareness and testing. You have issues around prevention, around treatment adherence, around policy and funding. And it strikes me as quite overwhelming. So I'm wondering, maybe if you could talk us into your research a little bit and talk about where you see your research sitting at these intersections of some of these phenomena.
So, in part, the cascade of opportunities for points of intervention are obviously myriad, like you said. Mine is more focused on the individual, and so a lot of my work is understanding particularly spirituality as a feature in the lives of gay and bisexual African American men, African Americans in general as it relates to HIV. And it goes something like this. So in 1986, 87, the Washington Post magazine had done a story on long-term survivorship of people living with HIV. And the central crux was, at that point, there were no drugs. And so they focused on, and a number of the informants talked about spirituality as a factor that sustained their life. What was interesting, they ran that study twice, in 86 and 87, and in both instances, none of the informants were African American. And that was problematic for two reasons. One, in the city of Washington, I knew from the onset of the epidemic, it has always been overburdened in populations of color. as that also, when you recognize coping strategies primarily for African Americans, religion and spirituality is a central feature. The Pew Foundation supports this. Many national studies support this. At the point, there were no drugs. And so then I became curious around, one, why weren't there people of color in the survey, number one? And number two, what would we learn by understanding the dynamic and how African Americans particularly understood and conceptualized spirituality? And so that became the crux and the impetus for my research.
Great. And it also seems, if you could, I don't want you to necessarily walk us through your entire curriculum vitae, but you have quite a lengthy experience studying HIV/AIDS and the intersection with African American gay men and spirituality. And it seems to me, just from looking at your CV quickly, that you've been studying this since the early 90s in some way or another.
Yes.
And that's really remarkable to be developing a research career of that length and that scope of quality. And so to the extent that you can reflect back on a little bit about that, what have you learned and what have been some of the important sort of learning pieces for you personally?
I think the first thing is there is a profound difference in distinction between spirituality and religion. And it's odd to think about it and not to get too theoretical about this. The etymology of the word religion is Latin for I can't say it right now because I'm thinking about it. But it's this notion of to blink or to rebind. We conceptualize, the popular understanding of religion is a series of laws and structures, a sociological phenomenon that has God as some kind of, for Christian and Western thought. Spirituality is differentiated in that, so it's less about a sociological phenomenon, far more about an individual regulation of one's pursuit of meaning, purpose, beauty, highest good, and goals. However we think about that, the average person doesn't get that deep into it. What they do understand is that spirituality and religion in an African American community on the main has to do with support and relationship. There's a family legacy involved in it. And quite frankly, if we think about the historical evolution of religion among African Americans, and let's understanding, one, the Black church is not a monolithic entity. However, there are some generalizable attributes to it. Black church was found for religious education, spiritual formation, and a buffer against social oppression. Mm-hmm. What becomes odd about this is that within Black church, there are some populations for which, and there's lots of reasons for it, but there are some populations that are more stigmatized and don't enjoy the same kind of buffering from oppression. Black gay men is one such population. And to understand the heavy load of burdens that these men experience, disease stigma, sexual orientation stigma, and then just the existential crisis related to what's going to happen to me, typically at a very young age. A number of these men, despite the alienation, maintained a focus on spirituality. And in so doing, they were able to sustain and maintain their lives to the extent that they could in the absence of the medication. With the medication, their lives have become a very different experience with the overlay of spirituality. And to the point, I think the thing that I'm working on right now is what are the particular factors and the essential elements of spirituality. And what I'm coming to right now is a sense of autonomy and self-efficacy and personal responsibility. And as I think about those things, it seems to me that those three ideas, in fact, I'm doing some writing and grant development on it now, if we can begin to understand that and highlight those elements as factors for managing both issues of HIV prevention, but also qualities of life, I think we've done something. And so part of that over the next couple of months, I'll be putting together a proposal to figure that out. And I'm looking forward to it. It's actually very exciting to me.
So when you talked a lot about the importance of spirituality,
yes.
Is there any, we've talked a lot about the medical progress that we've had. Is there anything that we're doing for that spiritual piece in regards to incorporating that into a type of treatment, not treatment medically, but in the type of ways to help handle the emotional issues? Is there anything that's being done sort of on the bigger stage to make this know that it isn't something that is important? It is something that should be addressed to help the overall person going through this?
So your question has two parts to it. And I would first say the first part is that several medical schools have actually introduced the concept of spirituality in their curriculum. And so this idea about it might not be part of the medical regimen. In point of fact, it ought to be. Because if we're talking about treating the whole person, and then social work, medicine's starting to get it, but we've known for a while it's a biopsychosocial, and we've known for the last 15, 20 years a spiritual component to that. That's number one. To the second portion of your question, I think the issue is spirituality is understood in some ways as a series of relationships. A relationship with yourself, with the environment, with your other people around you, and for those for whom it is reasonable, the divine. If there is a holistic understanding about one's connectivity to themselves and their environment, they're going to see their connectivity and see their self-worth. It's the same idea around social support, right? And as people begin to understand that they're connected and that they matter, people will begin to hold responsibility for each other. And so there's a kind of external and internal constraint, if you will, a motivation to I matter. And I think that it serves as certain motivations to take care of oneself. I think depression is the alienation of yourself from your psyche. I think spirituality has a way of being able to regulate some of that. In the same way that people engage in personal violence or people engage in other kinds of behaviors that are not adaptive or self-efficacious, in some ways, there's some beginning literature to suggest that spirituality can ameliorate some of that. And so I want to further that.
But it seems like it's such an important part that it can't be left out. It has to be sort of pushed and shown to even to the medical community who aren't getting it yet, that it really is that whole person approach in regards to helping the whole quality of life, going as you're going through this.
I think that's right. And I get, just to put a plug in, and I'm very grateful for my dean for allowing me to be able to put together a course on spirituality and social work here at the university. It's one of the best things I do here. I
would agree with you, and I also think it's quite remarkable the role modeling that you can provide for students, because this is something that is that you really are setting a leading example in terms of the research you're doing, but also bringing that scholarship and research into the classroom, teaching students in social work and here wider at the university that these are important issues, that they need to be dealt with, that they should be part of the discourse in the community. And I really applaud you for that. I think you're leading the way.
It's a huge honor and privilege.
And people are noticing just from hearing students, your course is quite popular among students. So I know it's something that a lot of the individuals going through the master's program think that it's an important part to hear you talk about this.
So we're going to take a quick break here for a public service announcement, and we'll be right back with the second half of The Social Workers.
I'll pick you up after school. Okay, I got it.
It's easy to take a day for granted. You and your family are connected by routine, and you stick to it. But what if a disaster strikes without warning? What if life as you know it has completely turned on its head? What if your day's routine is disrupted and you can't reach your family? Have you planned for that? Before a disaster turns your family's world upside down, it's up to you to be ready. Get a kit, make a plan, be informed today. Learn how at www.ready.gov. Ready.gov. This message brought to you by the Federal Emergency Management Agency and the Ad Council.
We're back to the Social Workers Radio Talk Show on WCDB 90.9 FM. We're here with guest Dr. Robert Miller, and he's talking about HIV and spirituality and all of his research. Welcome back.
Thanks very much. So one of the things that in the earlier question was, how has the landscape changed related to HIV in communities of color? What is striking now is that there are a number of communities that are actually being able, under the president's mandate, to literally have an end of AIDS. In San Francisco, the exemplar is still astounding to me. So we remember in the early 80s, there were 3 hotspots: San Francisco, Los Angeles, and New York City. In 2005, 6, or 7, now it's a little bit of a blur now, San Francisco's health department came to the place where they no longer held HIV as an epidemic. And so with the reduction of that status from epidemic to chronic illness, a certain set of factors came into play. At the conference, at the summit, I learned that by the year 2016, there is an expectation that there will be no more than 30 new HIV cases a year. 30. And so the premier AIDS service organization in San Francisco is the San Francisco AIDS Foundation. They are retooling their entire program. And so they're moving from an AIDS service organization to becoming a wellness center. The state of New York has also taken on that same mandate. And as I'm understanding, there's an expectation, and my travel is, I can't remember over which time period, but they're moving from a place to move from 3,000 new infections a year to 750. I'm thinking that statistic's correct. But it's a dramatic reduction over a short period of time. And the AIDS Institute, and under the governor's leadership, is making drastic improvements around how we're going to see the end of AIDS, which again is consistent with the Obama administration's mandate. The thing that's interesting to me about this also is while we're seeing these dramatic differences and decreases in epidemic, it's still this idea about differential health outcomes according to race and economics. And so what is striking to me is that of the average white gay man who is on care has a viral suppression somewhere in the neighborhood of 42%. Namely, of all the men who are in care, 42% of that men experience viral suppression. For African American men, that viral suppression is 35%. So literally 1 out of 3 men have viral suppression in a way that, and that's a huge challenge for which the state and many municipalities are going after the change. And one of the things that has been helpful, if not a boon, on my own research is that I'm in partnership with the AIDS Institute to engage in a study to examine how do HIV-negative Black gay men sustain their status. And so part of asking that question also gets to understand what is the utilization of PrEP, and to the extent that you always get your own question in there, what is the utilization of spirituality in the lives of HIV-negative men? The lion's share of my research has been around guys who are positive. I don't know this around HIV-negative men, so I'm excited about that.
It seems like a significantly different way of looking at the problem, coming at it more from a preventive standpoint, from a point of health and wellness self-management. And I wonder if you have any thoughts about sort of decisions whether or not to engage in risky behavior for men that are at risk for HIV/AIDS transmission.
So when you find a conversation that's healthy about sex, let me know. Because I don't know that we understand sex well. I think what happens is if the strongest impulse is survival, the second strongest impulse is sex. And oddly, we never tell women not to have sex. So when we engage in pregnancy reduction and those kinds of planned family planning and those things, we don't tell them not to have sex. We ask them to negotiate and to think before they engage in the behavior. And in the same kind of way, I think what we're having to think about is not telling guys not to have sex, but to think about what kinds of intentional risk they want to expose themselves to. And it's a negotiation. The issue at hand is people aren't talking about sex, or just doing sex. And to the extent that we can be thoughtful about our behaviors, and that goes for everything, I think we'll have a far better opportunity of managing the disease in ways that we aren't doing right now.
It's really quite inspiring to hear you talk about this, because it's clear you've conceptualized these things well and that you're writing about them, your scholarship is being disseminated, and you're making a difference out there. So I'd like to shift topics of discussion quickly here, because we have about 20 minutes left in the Social Workers Radio Show. I'm your co-host, Eric Hardiman, with Alyssa Lotmore, and we have Dr. Robert Miller from the School of Social Welfare in the studio here with us as our special guest. One of the things that you've done over the years, Dr. Miller, is that you have begun to develop, more than begun to, but you're well into the process of developing a long-term partnership with Africa, and that takes a number of different dimensions for you. I know that you've been on faculty in some universities there. You have led student tours of Albany students to Africa, study tours for a number of years.
Yes.
And so I'd like to ask you to tell us a little bit about your history with the continent and how you've developed your experiences there over time.
So it's always an interesting place where to start on this. I go back to the place when I was 16. I had an opportunity to do a study abroad. I think it was Paris and Spain. And I remember thinking to myself that I was not going to go to Europe before I went to Africa. Not quite sure what that was about. I'm just very clear about it. And then I got to Albany in 2000 and thought, wow, here I am. And there's a program started by Professor Emeritus now, Dr. Shirley Jones. She may not be emeritus, but Dr. Jones started this program at the university in the School of Social Welfare, U.S.-Africa Partnerships to Build Stronger Communities. And it was extraordinary. The first trip that I went on that she led was Ghana and South Africa, and those were two of the places I wanted to go to. It was a dream come true. As time progressed, Shirley transitioned out of the leadership of the program, and I had the opportunity to take it on. Simultaneously, I was named a visiting professor at the Addis Ababa University in Ethiopia, where I taught in the doctoral program, and I taught a qualitative research course. So being able to conflate both sustained time in Africa, Eastern Africa, and to do shorter trips is an extraordinary opportunity. And so the program now is, as it was before, it's a policy-based course, Africa Poly and Social Work, and we take students, you have to enroll in the course, and it's a study tour. And so the intention of the course is to understand the policies that undergird the provision of HIV, gender rights, and child welfare social services. And the students do an analysis of the policies while they're in country. And so they have the opportunity of talking to agency directors, education-based directors, and community and political heads, all the stakeholders related to policy. And then they come back and they write a paper. What the other many amazing things that trip has afforded me personally is an opportunity to understand Africa in a way that I would never have had the opportunity. There are long-standing relationships that Shirley started that I've been able to maintain and then build on in South Africa. But I've also been able to do some work in Eastern Africa. And so at this very moment, I'm working with the University of Dodoma to understand how they manage tourism sex among adolescent gay and bisexual men, adolescent boys. At issue is the overlay of economics and a lack of education and other unstable circumstances that create instability in these kids' lives, which then force them into commercial sex work and tourism sex. To the credit of both the university and community leaders, they want to understand that better. They want to make differences in these kids' lives. And so we're partnering to put together a grant to understand some of that. And the challenge, of course, is that while those community leaders are very interested in understanding the development and sustaining of civil society, including the marginal and the oppressed, some African countries are having real challenges related to managing same-sex behaviors and orientation. So much so that people are trying to legislate anti-homosexual laws that will either, at the worst, kill them and at best put them in jail for years. And so it's against that backdrop that social work is there trying to do what we do, namely engage in advocacy to increase people's levels of social functioning. And in a concrete way, trying to understand the construct of what marginalizes and oppresses these adolescents, and how do we engage in interventions to restabilize their lives. And the chunk of that has come out of this work, out of the study tour.
And when you talk about the study tour, I mean, you've had years of experience and knowledge and research. When you're taking students with you, how are they responding, from your perspective when they're going into another country? And you sort of have a little bit more background because of your knowledge. What is some of the reactions of them as they're going into another country and just sort of seeing the way policies are set up or the way another country is, sort of addressing issues compared to that in the U.S.?
So the first thing is I have to take take my hat off to the students who go on this trip. To the extent that traveling is far more stressful than people think. And this idea of getting on a plane for 14 hours across several time zones and ending in a place where there's English is spoken there, but they're looking to another adult to provide leadership and safety for them. These are functioning adults, and that having to relinquish some of their own personality around that is a huge feat. And so I always take my hat off to them for that. I think the answer to the question goes something like this. They've always wanted to go to Africa. Once they step foot on the continent, they become overwhelmed in a really wonderful way. And they begin to understand that it's a big world out there, number one. And I think what really impresses upon them is this notion of, while we are engaged in understanding the dynamics of the human condition, culture is a huge construct. And I think what happens is people come to a place of, I'm learning more than I thought, and it's different than the book. And so in that way, they're always grateful that they have the opportunity.
Well, it just seems like such an exciting tour, and just that you can learn so much. And I think we actually have a student calling in who traveled with you, Ashley, who traveled with you from to Africa. Ashley, are you there?
Yes, I am.
Hi, welcome.
Good morning.
Thanks for calling in, Ashley. We've got Dr. Miller here with you. And Ashley, you're calling in from Binghamton, is that correct?
Yes.
Good morning, Ashley. How are you?
Good morning. Good, thank you.
So, Ashley, we wanted to have you on to ask you a few questions about your experience with the Africa Study Tour. We know that you traveled with Dr. Miller just this past summer to Africa. And if you could maybe tell us a little bit about your experience and what that was like for you as a student.
Sure. I mean, I don't know how I can even put it into words. It was really indescribable. It was such a learning opportunity, and such a learning opportunity personally as well. I mean, I did a lot of work academically. Like Professor Miller mentioned, there was a paper due at the end of it. So there was some academic work, but there was so much personal growth. And it was just a whole other experience to experience a different culture. It really teaches you a lot about yourself.
What were your expectations going when you were, when you decided to go on this Study Africa tour? What were you? Did it meet your? I'm sure it was above expectations. But what were you sort of when you said I'm going to Africa? What did you expect to see there? What were your thoughts before you arrived?
Luckily, I had the opportunity to travel to South Africa in 2012. So I was a little familiar with the country, and I've done a couple things there, but this was still a different experience. I had the expectation that I was going to learn. I didn't think I was going to learn too much about myself. And every day I learned something different, and it just taught me a lot about my own thinking and why it's important to change your mode of thinking and to have these different experiences and gain these different perspectives.
Can you give an example of something that you said that you changed? It was something that was sort of eye-opening for you, or it changed your expectations on things. Can you have an example of something that you saw or that you were exposed to that sort of helped you change that way of thought?
Sure. I think Professor Miller is probably going to laugh at this because we experienced this together at a museum in South Africa. We were at the District 6 Museum, which memorializes people who have been pushed out of their homes in the name of apartheid. And we met this wonderful gentleman there who told about his experience with apartheid and how he was personally victimized and how he was personally asked to move from his home and how he did it. And it was just a story of resilience and a story of really a rich, deep history that I think is so important to not only to South Africa but globally and to social work in general. And it was such a moving experience. It's such an amazing thing to hear it straight from the horse's mouth. It was incredible. It was different than reading from a textbook,
Dr. Miller?
So one of the things that I am deeply grateful for is the caliber of students who come, who actually are interested in coming to the program and then actually show up. Ashley is exactly one of the students that if there's such a thing as a perfect student, it would be Ashley. Because as it stands, is interested, thoughtful, always wanting to learn, inquisitive, and able to negotiate the challenges that the tensions of a trip will bring up. And despite those, being able to be flexible as well as engage in a series of learning opportunities that promotes learning for everybody. It was terrific. What she didn't tell you is that I was talking to that gentleman in the kitchen, and she just walked in, and she happened just by happenstance. And that what he began to describe in terms of his own kind of personal volition to maintain his own character, maintain his strength of, this is my land, I will not be intimidated by anybody, was an extraordinary moment to see. It was an extraordinary moment to see. And it was wonderful to see a student understand what she was seeing and experiencing. And then ultimately it was just being able to share a lovely human moment with three really terrific people.
It strikes me as one of the things that you guys do with this trip to the study tour to Africa is that you really engage students in a way with a combination of both traditional academic learning, travel, real-life experience, cultural exchange, and also actually generating knowledge. And I wonder if either of you, Ashley or Dr. Miller, could talk about that, some of the knowledge that you generated.
Ashley?
I think one moment specifically that stood out to me was a conversation we were having about female genital mutilation while in Tanzania, and I'm sure Professor Miller remembers this
yes,
well.
I do.
We were talking to a professor at the University of Dodoma, and his views were a little bit different than the views of us as social workers, and so having that conversation and really it was witnessing traditional ideas and things that we talk about a lot that come from Tanzania and other rural African countries, and seeing that in front of me and having that conversation, and it was transformational almost. It was definitely a learning experience for me.
So what's interesting about that is understanding Ashley to be a staunch feminist thought, and having to see a diametrically opposed thought and watch her negotiate both those ideals was actually kind of fun to watch, and again speaks to who she is as a thinker. I think for me, it was we were in Cape Town, South Africa, and we were at the University of the Western Cape. And there, in that university, one of the divisions is a theology school. And it was listening to the students who their parents were the ones who fought through apartheid, and here they are now post-apartheid, integrating the universities and so forth. And yet the stark reality is that 80% of the population only experiences 20% of the wealth and 20% ownership of the land. And in particular in the School of Theology, to hear people think through and negotiate how they make sense of a sociological phenomenon, a political reality, in the context of a theological context, it's just striking. And to watch students maintain hope and try to, rather than be discouraged by the current set of conditions, understand that the fight continues and that they understand the fight and they understand that there are new strategies required to win the fight. And watching that and watching the resilience in the human condition is extraordinary to me.
So for those listeners who are just tuning in, you're listening to The Social Workers, and just speaking was Dr. Robert Miller from the University at Albany School of Social Welfare. We also have Ashley Dawson on with us from the University of Binghamton. Ashley, could you tell us a little bit about your current studies and what your plans are for the near future?
Sure. Right now, I'm a second-year student of social work. It's a Master's of Social Work program, a 2-year traditional program. I'll be graduating in May, thankfully, and hopefully moving on to public health school sometime either in the fall or the following year.
Great.
And what has, as you've traveled back from Africa, what is something now that, you can share with your peers, with your classmates about your trip? What was something that if you had to say, sort of wrap up in a sentence, what was something that you took away with you that you will always have that, ability to say, I saw this and here's how it changed my view? Was there something that stood out for you?
I think the thing that stood out most was something we learned pre-departure, and I took with me and really experienced while I was there. Dr. Miller really instilled in us the importance of meeting people where they are and understanding people from their perspective in the way that we're asking them to understand from ours. And so that was super important, coming to a place that had different values and many people had different perspectives. And so coming there and trying to understand and like Dr. Miller said, negotiate that was difficult, but it's so important, and I hope that many other people have that experience. It's so necessary to understand things from other perspectives. It's in the work that we do as social workers.
Well, Ashley, I think that is a pretty wonderful wrap-up that you just did, because that's a really important thing that social workers, we talk about that in classes. As you know, all your classes sort of talk about meeting people where they are. But for you to actually have experienced that from at a place where there's completely different cultures, and being able to practice those skills on how to actually meet people where they are, and now you can take it back and share that with those in Binghamton and all the people that you encounter through your career. I think it's a really wonderful thing to have experienced.
Yes, thank you.
Thank you so much for calling in, Ashley.
Thank you for having me.
Best of luck in the future, too.
Thank you.
Okay, so we are in our last 5 minutes here with Dr. Miller, Dr. Robert Miller from the School of Social Welfare. You are listening again to the Social Workers Show on WCDB Albany, the show that was pioneered by Catherine Zox and now has been shifted this year. This is our first show. We spend an hour every month. So from 9 a.m. to 10 a.m. on the first Thursday of every month, we will be live in the air with a variety of different guests. We've got some very exciting guests lined up for the next few months. And those will include students, faculty, community leaders, researchers, program executives, all sorts of folks from the community. We may have call-in guests. We have an exciting academic year planned on the show. On the alternating Thursdays, the second, third, and fourth, and fifth, if there are any, Thursdays of the month, you can hear the show repeated. So if you would like to, if you tuned in late and you'd like to hear more of what Dr. Robert Miller had to say about HIV, AIDS, spirituality, and gay African American men, among other things, the Study to Africa tour that he's been talking about for the last few minutes, you can hear this exact program repeated next Thursday and the following 2 Thursdays before we go live again in November. Dr. Miller, do you have some summary thoughts about what we've talked about today?
Well, there is going to be another study tour trip next year. It will be sometime, typically the last 2 weeks of July and goes through the first week of August. There may be some adjustment depending upon schedule constraints. So if people are interested in that, you can email me at rmiller@albany.edu. So you always got to put a plug in for the Africa trip. It really is the best thing that I do here. Ultimately, what I would like to say is that AIDS is not over. I think people need to understand that we are in a far more critical stage because people do think it's over. I think that on the main, understanding and being intentional about your health risks are important. Maintaining a sense of self is also important, and that ultimately social workers are extraordinarily positioned to be able to provide interventions and supports and to negotiate and advocacy services, all the things that we do. HIV is ripe for what it is that we can do, and I'm just grateful that the school and the dean support my efforts in this, and I'm grateful that students are still interested in being able to figure out how they can make differences in people's lives.
Well, thank you so much, Dr. Miller, for coming on and sharing all this research and knowledge with us. And if you, again, as Dr. Hardiman said, if you want to tune in, you can tune in every Thursday, and it's also going to be posted on YouTube, which you can access either on the Social Workers Radio Talk Show YouTube page or our Facebook page, our Twitter account, and also there's a main link on the albany.edu Social Workers School of Social Work page. There's a link to the radio show, which will also have the link to the YouTube page so you can listen to the show again.